that divides the body longitudinally into two halves, the right and the left, the two equal halves. All those planes which are passing parallel to the sagittal plane are known as parasagittal planes. The transverse plane is a horizontal plane which divides the body into an upper or superior part and a lower or inferior part, whereas coronal plane is again a longitudinal plane which divides the body into two equal halves, a front or anterior part and a back or posterior part. In ultrasound, it is very essential to examine each and every structure in at least two planes which are perpendicular to one another, that is either the sagittal with transverse or coronal with transverse planes, to get a better idea of the anatomy and pathology in the structure. First of all, we will briefly discuss about the terminology, various terms that are used in ultrasound. So, what is ultrasound? These are the sound waves and they have a frequency which is greater than the human audible range. These sound waves are mechanical energy producing alternating compression and rarefactions. The sound waves are longitudinal waves unlike the electromagnetic waves, and the human audible frequency range is from 20 Hz to 20 kHz or from 20 Hz to 20,000 Hz. Example of a wave. A wave usually has a portion which is above the baseline and is known as crest, and a portion which is below the baseline is known as trough, and one crest and one trough constitute one cycle or one complete wave. The distance between two similar points on the wave, that is the distance between two consecutive crests or two consecutive troughs, are known as the wavelength, which is denoted by lambda, and the number of waves passing through a particular point in 1 second of time is known as the frequency of the sound wave. On the long axis we have the pressure, on the transverse axis or x-axis we have the time. So this is a graph of a wave plotted against the pressure with time. This is the crest, this is the trough, the wavelength. The maximum vertical distance of the wave from the baseline is known as the amplitude of the wave. So as I said, crest is the portion of the wave above the baseline, trough is the part of the wave below the baseline. One cycle is one complete wave, that is crest plus trough, which will form a cycle or a wave. Amplitude is the maximum vertical distance from the baseline, either above or below the baseline. Wavelength is the distance between two consecutive points of a wave, like distance between two crests or two troughs. Frequency is the number of waves or cycles in 1 second time, whereas hertz is the unit of frequency of the sound, and 1 hertz is equal to 1 cycle per second. It means that if we have a wave in which one wave is passing through a specific point in 1 second of time, the frequency of that wave would be 1 hertz. Wave equation. The wavelength is equal to the speed of sound divided by frequency. Speed of sound is equal to wavelength into frequency, and frequency is equal to speed of sound divided by wavelength. This wave equation clearly shows that the frequency and wavelength have inverse relationship with one another. When the frequency increases, the wavelength decreases, and vice versa. Higher the probe frequency, the shallower the tissue depth that can be imaged. The penetration of the sound wave, or the depth which can be imaged by a wave, depends upon the wavelength. Greater the wavelength, higher will be the depth that the wave can penetrate, lesser the wavelength, lesser will be the distance that the wave can travel. And as we said, that wavelength is inversely proportional to the frequency, so higher the frequency, lesser will be the penetration. But on the other hand, higher the frequency, better would be the resolution, that is the clarity of the image. Use the highest frequency possible to image any structure. Obviously, the aim of doing ultrasound is to look at the things as much clearly as possible, and that can be done by using the transducer of higher frequency, because as we said, the frequency is directly proportional to the resolution, the clarity of the image. But the problem would be that with increasing frequency, the penetration would be decreasing, and a limit is reached when we are unable to penetrate into the structure at all, and that won't give us any information. Therefore, there is a cutoff mark between the penetration, that is the wavelength, and the frequency where we can use, which we can use to image adequately. So wherever possible, when we have the adequate penetration, we must use the highest possible frequency for that adequate penetration to get the best image possible. This is an example. You can see the two transducers. One of them has a frequency of 3 MHz, the upper one. The other has a frequency of 6 MHz, the lower one. If we come to the wave length, the 3 MHz probe has a wavelength of 0.5 mm, whereas 6 MHz transducer has a wavelength of 0.25 mm. As we said in the beginning, lower the frequency, higher will be the wavelength, more will be the penetration. Higher the frequency, lesser will be the wavelength, lesser will be the penetration, but better would be the image. The resolution would be better with this probe. Resolution will not be better with this probe, but this probe will give us less penetration and this probe will give us more penetration. So where we need penetration, for example in obstetrical ultrasound or in abdominal ultrasound, we will use this transducer, and where we don't need penetration, like ultrasound of the testis, thyroid and superficial organs, we will use this transducer. Two more examples. This is a transducer where the frequency is 5 MHz. This is a transducer where the frequency is 3.5 MHz. Lower the frequency, more will be the penetration, because more will be the wavelength. So you can see that this lower frequency transducer can penetrate more as compared to the high frequency transducer. But the high frequency transducer will have better resolution and will give us a better image, although keeping in mind that it will have less depth, it will have less penetration. The lower frequency will penetrate more but will have less resolution. Medical diagnostic ultrasound is the use of ultrasound of high frequency sound waves traveling through the human body, and the frequency range of these waves is from 1 to 30 MHz. 1 MHz is 1 million waves per second. So in medical diagnostic ultrasound, we use sound waves with very high frequency in the range of millions of waves per second, and these sound waves pass into the human body, are reflected back and give us the images. The ultrasound images are tomographic, that is the images are in slices, are in sections, just like the images of the CT and MR scans. Ultrasound study is real time, that is physiological movements within the body are depicted as such, like we can see the diaphragmatic excursions during respiration, we can see the heartbeat as it is happening. Ultrasound images are in grayscale, and the number of gray shades are between absolute white and absolute black. We know that mixing of black and white gives us the grey color. And in ultrasound, we see the images in all shades of grey, which are bounded between the extremes of black and white. On one side is the white, on the other side is complete black, and in between the images are displayed in all shades of the grey. Ultrasound waves are produced by vibration of crystals in response to an electrical current, and this is known as piezoelectric effect. Piezoelectric effect is the property of the materials which can convert one form of energy into another form of energy. Like these crystals can convert electrical energy into sound energy and the sound energy back into the electrical energy. This electrical energy can be displayed on the ultrasound monitor. These crystals are encased in a box which is known as a probe or transducer. When the ultrasound waves are reflected back from the interfaces in the body, these reflected sound waves are known as echoes. So one of the basic element of an ultrasound machine is an ultrasound transducer, which is also known as a probe. This ultrasound probe or transducer has specialized crystals which are made up of which have the properties of piezoelectricity, which are the properties by which the one form of energy can be converted into another form of energy. When high voltage electric current passes through these crystals, they convert this electrical energy into sound energy, and these sound waves are high frequency sound waves which are passed into the human body. Within the human body, these sound waves are reflected back, are caught up again by the transducer, which converts them back into the electrical energy, and this reflected ultrasound wave, which is known as echo, is displayed on the monitor of the ultrasound machine in the form of images. These echoes form the basis of ultrasound images. Echoes arise from acoustic interfaces, and acoustic interfaces are the boundaries between materials with different acoustic properties. So you must keep in mind that the reflection of the sound wave occurs only at the interfaces. Now, what are the interfaces? These are the junctional point of the materials with different density, with different acoustic impedance. For example, the boundaries between two organs are the boundaries between different structures in the same organ. Like liver and kidney have a boundary between themselves, and if we come onto the liver, within the liver different structures like hepatic vein form boundaries with hepatic parenchyma, portal vein branches form boundaries with hepatic parenchyma, hepatic vein and portal vein form boundaries with each other. So whenever there is a difference of density, the reflection of the sound wave will occur, that will give rise to an echo which will form the image. If the medium is totally homogeneous and has no interface, no echoes will form and the structure will appear as anechoic or completely black. So if the image is homogeneous and there are no interfaces, no reflection of the sound wave will occur. The intensity of echoes depend upon the difference in acoustic impedance, that is the density of the material at the interface. So these echoes which are reflected back, their intensity or their brightness depends upon the difference in the density. It doesn't depend upon the density of an object, it depends upon the difference in the density of the two medium forming the interface. Higher the difference in the density of two medium, more will be the reflection of the sound waves. Lesser the difference of the density of the materials at the interface, lesser will be the reflection of the sound waves. This acoustic impedance, which is denoted by Z, is the product of the density of the material R and the propagation of the velocity of the sound C. So Z is equal to R into C, which shows that greater the mismatch, greater will be the production of the echoes. It should be remembered that the echoes are not related to the density of the substance only, so harder is not necessarily brighter. It is the impedance mismatch which is important. So air tissue interface is very echogenic, as is air bone interface, whereas the muscles fat interface is not very echogenic, because here the difference in the density of the two medium is less as compared to the difference in the density of the two mediums between air and bone or air and tissue. Ultrasound images are made up of small dots on the screen. The brightness of the individual dot corresponds to the intensity of the echo received. So the greater the echo, the brighter the dot. The echo is translated into brightness in forming images, and this is called B-mode ultrasound. The machines nowadays which we are using, the ultrasound machines, they are also known as B-mode scanners or brightness mode scanners, because the reflected sound waves, which are echoes, they are translated onto the monitor in terms of brightness. Strong the echo will give the brighter dot on the ultrasound monitor. Weak reflected echo will give a darker dot as compared to the high reflection. Acoustic reflection and refraction. A sound wave reflected at an interface is referred to as an echo or reflected wave, and it is then converted into an ultrasound image. So when sound waves strike a medium and return back into the same medium, it is known as reflection of the sound wave, and these reflected sound waves form the ultrasound images. Whereas refraction is the change in the direction of the transmitted sound wave at a specular interface. So in refraction, the sound waves are not coming back to the same medium, rather they continue their journey into the second medium with a change in their direction after striking an interface. As sound passes through a tissue, the pressure wave diminishes in amplitude as the energy is lost, and this loss of energy occurs due to the absorption, reflection and scattering. This loss of energy of the sound wave as it is passing through a tissue is known as attenuation. This is well shown by this wave diagram. The amplitude or the pressure of the sound wave is diminishing as the wave is passing through the tissue, and this decrease in the amplitude is because of absorption, reflection and scattering of the sound wave, and is known as attenuation. Attenuation determines the depth at which the structures can be imaged and depends both on the tissue being examined as well as the transducer frequency. We have said in the beginning, lower the transducer frequency, more will be the penetration. So we will be able to see deep into the tissues. Higher the frequency, lesser will be the penetration, so we will not be able to see the deeper structures. Secondly, it depends upon the organ itself. An organ which is very dense like liver, which is a heavy and large organ, obviously when the sound waves are passing through the entire depth of the liver, there will be attenuation of these sound waves. The higher the frequency, the higher will be the attenuation and lower will be the penetration. Attenuation causes amplitude lowering in deeper tissues, and amplitude is transmitted into the brightness. So as we go deeper into the tissue, the brightness will decrease because of the decrease in the amplitude of the sound waves. But our aim is that similar lesions at different depths should look like the same. That is our aim. But in actual practice, it is not possible because the sound waves are losing their amplitude as they are traveling within the human body. We will discuss it in detail in the further coming slides, that to overcome this attenuation and to overcome this loss of amplitude of the sound wave as it is passing through the depth of the tissue, there are different knobs to control this loss, to overcome this attenuation, and then we will be able to see similar lesions at different depths as to appear similar in shape and texture. Another example of attenuation: an adult and a child. Adult has more body mass as compared to a child, therefore there will be more attenuation. To overcome more attenuation, we will require a transducer with lower frequency, because that will have more power of penetration. That is the reason that we use 3.5 MHz transducer for adult scanning. In child, the body mass is less. The sound waves need to penetrate the body less. Therefore, we don't need the higher wavelength, which means we can use the higher frequency, and therefore in pediatric scanning, 5 MHz transducer can be used easily. An ultrasound image to show attenuation. This is a slide of uterus with a large fibroid in it, but you forget about the uterus and the fibroid. Just concentrate on the appearance of the image as we are going from superficial to deep portions. In the upper regions, the image is brighter and it progressively becomes darker as we go deep into it, and in the deepest positions it is almost completely black. This process of loss of brightness, the loss of characterization of the image as we penetrate deep into it, is known as attenuation, and this can be overcome by shifting towards a frequency, towards a transducer with lower frequency. Next is the shadowing and enhancement. What is acoustic shadowing and what is acoustic enhancement? First we will discuss acoustic shadows. Acoustic shadow is a dark area posterior to a high attenuating structure like stone, bone and metal, and this is caused by absorption or reflection of the sound of deeper structures. To explain this, when sound waves strike an object which has the power of attenuation or reflection because of its density, then all the sound waves will either be absorbed or reflected back. And this occurs typically with stones, bones and metals. So when a structure is reflecting the sound waves itself, it will appear bright on ultrasound. But when we go to the areas which are deeper to that structure, as no sound waves are able to penetrate through that structure, therefore there is no reflection of the sound wave from areas posterior to that structure, and we will have a dark band posterior to that stone, bone or metal, and this black band is known as acoustic shadow. Acoustic shadow is typically the properties of stones, bones and metals. Smaller stone will produce less shadows, large stones will produce more marked shadows. Opposite to this is acoustic enhancement. Acoustic enhancement is also known as increase through transmission, and in acoustic enhancement there is a band of increased echoes distal to a structure which is exhibiting low attenuation like liver cyst. So all those structures which are fluid filled like simple cyst, hydrated cyst, abscesses, hematomas, the structures which are filled with fluid, they show less attenuation and reflection of the sound waves. Therefore, when they are not reflecting the sound waves, they will appear as black. But what will happen distal to them? As no sound waves are absorbed or reflected, so the number of sound waves passing through those lesions will be more, so large number of waves will be reaching to the posterior aspect quickly, and there will be more reflection of the sound waves from the areas distal to that lesion, and these increased reflected sound waves will produce a white band distal to that lesion, and this white band is known as acoustic enhancement. Two more example. Here is the slide of a lesion in the breast, which is a dark lesion, but when we look at the distal portion, there is a band of brightness distal to it, and this brightness band shows that this lesion is fluid filled, and this band is known as acoustic enhancement or increased through transmission. We are in thyroid, and in the right lobe of the thyroid, again there is an anechoic, a black, well circumscribed, rounded lesion, and when we look at the distal aspect of this lesion, there is a bright band, and this bright band shows that this lesion is fluid filled and is known as acoustic enhancement. Acoustic window. Acoustic window is a structure that has no acoustic impedance and allows for the passage of sound, and thus gives enhanced visualization as unibladder is used to visualize uterus and ovaries. We use windows to look at other areas. Therefore, similarly in ultrasound, those organs or tissues that can be used to look at other organs are known as acoustic window. Those people who have had an ultrasound of the pelvis, those females, and the males for the prostate, they would know that a full bladder is required to scan the pelvic organs like uterus, ovaries or prostate. It is due to the fact that when the bladder is full, it acts as an acoustic window because the urine in the bladder will neither reflect nor absorb the sound waves, so we can image the uterus and the ovaries in a much better way. This is the unibladder, which is acting as a window to look at the uterus lying posterior to it, and we can see that in the center of the uterus, in its cavity, there is a linear white structure which is IUCD in the uterine cavity. This is a scrotal ultrasound. This is the testis, and we can see that the testis is surrounded by anechoic black area, and this is a patient with hydrocele, and this hydrocele fluid helps us to look at the morphology of the testis in a better way by providing us with the acoustic window. Coming to the various terms which are used in ultrasound, the first is anechoic. Anechoic means completely void of echoes. Anechoic is also known as echo-free, echo-poor or echo-lucent. These are the same words meaning the same. Anechoic, no echoes. This is the scan of the liver, and within the liver we have the right, middle and left hepatic veins which are draining into the IVC, and if we see those veins, they are anechoic. They are completely black. They don't have any echoes. This is a female pelvic ultrasound and an ovarian cyst which looks completely black. All those structures which on ultrasound look as black are known as anechoic, echo-poor, echo-lucent or echo-free, means that they don't have any echo, and we described in detail in the beginning that echo will be reflected as a bright dot, so they don't have any bright dots and they look black on ultrasound. The opposite of echo-poor is echogenic, and this term describes a structure that produces echoes depending on the number of interval phases it has, so it is white on ultrasound. All those structures are things that we see white on ultrasound are known as echogenic. This is a slide of the liver, and within the liver we have this small rounded white structure which is an echogenic lesion within the liver. This was a liver hemangioma. A female pelvic ultrasound, the unibladder is providing us with the acoustic window to look at the uterus, and within the uterus in the center of the uterine cavity we have a white longitudinal linear lesion which is an IUCD in the endometrial cavity. so that IUCD is looking white and is known as echogenic. So to summarize, all those things which on ultrasound are seen as white or bright are known as echogenic, whereas all those structures or organs which are seen on ultrasound as black are known as echo-poor, anechoic, echolucent or echo-free. Next is the echogenicity. Long before about 50-60 years, when ultrasound was invented, it was only used for obstetrical ultrasounds, but now it is used to look at various focal and diffuse lesions in all the structures and organs. And every organ on ultrasound has a specific grey shade. When you start scanning, and you will keep on looking at the specific grey shade for a specific organ, that specific grey shade of an organ is known as echogenicity, and it is essential to appreciate the normal echogenicity of the different organs, because it will help us, enable us to identify the changes in diffuse parenchymal diseases that occur in the echogenicity. In normal organs, the echogenicity decreases from diaphragm. In normal structures, the most bright structure, the most white structure on ultrasound is the diaphragm. As we go down the list, the brightness of the organs or structures reduces. So less bright than the diaphragm is the renal sinus or the central portion of the kidney. Still less is the pancreas, then is the liver, then is spleen, then renal cortex, and the most black or the least white is the gallbladder or urinary bladder. So as we are coming down, the brightness of the organs is reducing, the darkness is increasing. Therefore, when we are looking at the scan, the echogenicity of the renal parenchyma, that is the renal cortex, should be less than that of the liver. If the renal cortex or renal parenchyma is more brighter than the liver parenchyma, it would mean that either the liver is abnormal or kidney is abnormal. Therefore, it is essential to have an idea of the normal echogenicity of all the structures as compared to one another, because whenever there is a diffuse parenchymal disease, it will cause a change in the echogenicity of that organ or structure.